Hello, my name is Brecklin Abels, and today I'm going to be presenting my study review for the journal article Vitamin D Deficiency and Depressive Symptoms in the Perinatal Period. So what the research problem is that currently postpartum depression affects somewhere between 10 to 20% of all new mothers. There's a lot of complaints against this in the postpartum period, but it also affects women in their pregnancies as well. And that's kind of what this research article is looking into. There hasn't really been a whole bunch of research done on what causes or how to prevent postpartum depression. However, lots of people have been looking at vitamin D as possibly the answer to helping prevent some of this mental health disorders. So the sampling method of this study is that women were recruited from a large medical center in California. They were compensated for their time. They got $10 at the beginning of the study and then $10 at the end of the study. The women were 18 years or older, and they were less than 25 weeks gestation. They did estimate a sample size of 126 women. However, one woman did not get the first requirement done in time, and so there was actually 125 women. The randomization, this was a longitudinal study, so it was conducted over the length of the entire pregnancy, birth, and then postpartum period to 10 weeks. So the way the study was conducted, the women were asked to self-report their EPDS at 3 different points in their pregnancy, at 14 weeks, and then again at the third trimester, then at 10 weeks postpartum. What they were looking for was early pregnancy, and then as the women were headed into giving birth, and then how they were doing in their postpartum period. Blood draws were also conducted in relatively the same manner. So again, at 14 weeks when they were admitted for labor, and then at their 6-week postpartum. All of their demographic information was self-reported. And at each interval, women were screened, and if their EPDS came back as a 10 or higher or 15 or higher, they were referred for further assistance. They did take the EPDS scores and get an average score for those at each interval. So they were kept blind until the completion of the study. And it was the same situation with the serum levels of vitamin D. They were frozen until the completion of the study, and then they were compared with the EPDS scores and the vitamin D levels. So the study findings, basically what the researchers found was that women that had higher depressive symptoms, so an EPDS score of 10 or higher, had significantly lower vitamin D levels. So every time they ended up drawing and scoring the EPDS scores, there was a significant inverse correlation between vitamin D and depressive symptoms. Further research questions. This was a really well done study. However, the sample size was small, and the draws and the EPDS scores were not done at the exact same point in pregnancy, at birth, and postpartum. And so researchers do suggest conducting further studies to include randomized trials examining vitamin D supplementation, as this was just looking at vitamin D levels in relationship to the EPDS scores. So doing a randomized trial to include vitamin D supplementation would tell us a little bit more if this was something that could actually improve EPDS scores and women's depressive feelings. They also suggested studies that would accommodate significant clinical outcomes, such as postpartum hemorrhage, which is actually shown to be a trigger for postpartum depression as well, and reduce vitamin D levels, which causes higher inflammation in the brain, thus leading to more depression. So there's still a lot to do in regards of figuring out postpartum depression, but hopefully this is a step in the right direction. Thank you so much for taking time to listen to my presentation today.